Now, we've all heard stories of people who've had strokes or heart attacks. And when it comes to these medical emergencies, time is truly the most crucial factor. When someone suffers a stroke or a heart attack, it is often sudden, and every minute counts. A stroke happens when the blood supply to a part of the brain is blocked, or a blood vessel in the brain bursts. The brain cells start to die quickly without oxygen, and the longer the delay in treatment, the higher the damage. Similarly, a heart attack occurs when the blood flow to a part of the heart gets blocked, usually by a clot, making the heart muscle weak or die in that area. The most common feeling is a heavy or squeezing pain in the chest, often in the center. The pain might spread to the left arm, shoulder, neck, or jaw. Some people feel breathless, dizzy, or break into a cold sweat. If a heart attack is confirmed, they may use clot-busting medicine, or if available, perform angioplasty, a procedure to open the blocked artery using a small balloon, and place a stent to keep it open. Sometimes bypass surgery is done if the blockage is severe. After the treatment, medicines are continued to prevent future attacks. These include blood thinners, cholesterol medicine, blood pressure control, and drugs to reduce heart strain. Women, older people, or those with diabetes may not have chest pain at all. Most deaths occur not because of the attack itself, but because help arrives too late. And if you enjoyed this video, don't forget to subscribe and hit the bell icon for more health tips. Stay healthy and take care. In such moments, time is crucial. Keeping a calm mind and acting quickly could save a life. So in our families, workplaces, and communities, we should all learn these signs and actions. Because one day your calm mind and quick action could be the reason someone survives. Knowing what to do is just as powerful as any medicine. Instead, they might feel tired, nauseated, or just uncomfortable. If one side of the face doesn't move properly or droops, it may be a sign. This helps reduce strain on the heart. Loosen their clothes and keep the environment calm. If the person is conscious, alert, and not allergic, chewing one aspirin tablet can help thin the blood and reduce the size of the clot. But only if available and safe to give. Do not give water or food. Let them breathe fresh air and reassure them. If they faint or stop breathing, check for a pulse and breathing. If both are missing, begin CPR immediately if you know how. Then ask them to raise both arms. If one arm drifts downward or cannot be lifted, that's another clear signal. Next, ask them to speak a simple sentence. If the words come out slurred or they can't understand, don't wait. These 3 signs are the key red flags. You must call emergency help immediately. Remember, time is brain. The more time you lose, the more the brain gets damaged. In both cases, it's essential to recognize the signs and act fast. So let us discuss some ways to stay calm and recognize the signs of a stroke or heart attack. A stroke can be identified by the classic check, which is very easy to remember. Ask the person to smile. If the person is unconscious but breathing, turn them to one side so they don't choke if they vomit. Avoid giving them water, food, or any medicine. People often try to give herbal drinks or aspirin at home, but in stroke cases, this can be harmful, especially if there's bleeding inside the brain. Also, do not wait for the symptoms to go away on their own. The person must be taken to the hospital as quickly as possible, where doctors can run a brain scan to confirm whether the stroke is caused by a blockage or bleeding. If it's a blockage, a special injection called TPA may help dissolve the clot, but it has to be given within a few hours. If bleeding is found, surgery or medical control may be needed. Once a stroke is suspected, help the person lie down calmly. Make sure the head is slightly raised with support. Now let's talk about heart attacks. If you think someone is having a heart attack, make them sit in a half-lying position with their back supported and knees slightly bent. At the hospital, doctors will quickly check the heart using an ECG and blood tests. Both stroke and heart attack should never be taken lightly. If you find this information helpful, share it with your friends and family.